Today, the Ministry of Health has received 24 results of those who were tested with COVID-19. 23 came out negative and 1 came out positive. This becomes case number 16 since we started testing. Case number 16 is a 25-year-old woman of Woho region with a history of travel to South Africa, to KwaZulu-Natal province. The patient presented with a flu-like symptoms within 14 days of her return. She is undergoing the process of being treated for COVID-19. Of the 16, 8 have been discharged home. And of the 8 that we're still looking after, 3 of them are at the Lubombo Referral Hospital, 4 are being treated at home, and 1 is being transferred there today, the case number 16. The ministry wishes to emphasize that those who have been confirmed positive have a duty to report to the ministry to help the nation to make sure we can curb the disease. We will help you and you can help the nation. Secondly, if you're a suspected case, please stay at home if you're asked to stay at home and take all the precautionary measures to make sure that you do not infect others. We encourage very strongly that if you're a suspected case, you will wear a mask even inside the home. This is so that you do not infect other people within the home itself. The public is requested to continue collaborating with the rapid response teams that are going to come knocking on your doors, calling you to follow up and make sure that you are tested, screened and tested where it is necessary. All suspected and confirmed cases of COVID-19 should wear a mask. This is very, very important because this prevents you from infecting others. And from today on, we're encouraging the whole nation that when you're going out, wear a cloth mask. This is not going to protect you from getting the infection, but is going to protect the others from you. So if I wear a mask, I protect you from infection from me. If you wear a mask, you are protecting me. So if we wear masks outside, we will be protecting one another. This is also very important. But the ministry wishes to emphasize that the most important thing in this response is making sure that we keep our distances from one another. This is critical. And the second most important thing, well, they're all equally important, is to make sure that you wash your hands with soap and water again and again and again. And you cover your mouth and nose when you sneeze, and make sure that you do not affect others with your coughs. I'm going to give a very brief summary again of the 8 cases that are now active. We have had 16 cases to date, 8 are discharged, 8 are still under care. And these would be the case number 4, who is still being cared for at home, a 55-year-old woman, and case number 5, a 52-year-old man who's also being cared at home. We now have a number of cases where we do not find a clear history of travel. And the reason we're not able to confirm and say we definitely have local transmission is that as we do contact tracing, people begin to remember and they give us more and more details. But we begin to see a pattern here that shows that we're beginning to have some serious concerns with local transmission. That will change our case definition as we are going to be now looking at everybody who presents with a flu-like symptom. It is important that when you have a flu-like symptom of any kind, you call 977 or you present to your nearest health facility. So case number 11, who had no history of travel and was from the Manzini region, is still undergoing treatment. Case number 12, a female, a 36-year-old female who had contact with somebody from South Africa. The disease is mild and is recovering. Case number 13, who had no history of travel themselves but were in contact with somebody from South Africa, has mild disease and it continues to recover. Case number 14, the 14-year-old young man who had contact with case number 11 is very mild disease and is now being looked after at home. Case number 15, who is a 59-year-old man who has a mild to moderate disease, is being looked after at the Lubombo Referral Hospital. So is today's case is being referred and transferred to the Lubombo Referral Hospital for management. Again, we thank the nation for cooperation in this. We believe that we can manage this. We can prevent this disease from spreading widely across the country if we all work together and help one another to prevent this disease. Thank you very much. Ninebegnene, lamuhla sithole results lang 24 la ngamashumi lamabili nakune COVID-19. Labang 23 mashumi lamabili nakuthathu baphume baba negative. Ube munye kuphela lo vele waba positive. Lo imunye ngumakelo semncane lona 25 eminyaka losuka kule region yakaHoho. Unemlandvo wakhe ukuthi abe se South Africa eKwaZulu Natal lapha asesabuye khona atkanza sekane mkhuhlane ashisa angakapheli lo 14 days usenaka test wake wakhanzakala ukuthi positive. Njengamanje uyachubeka umikiswa elibonjeni lapha atawu sitwa khona ukuthi elulame. Lokho kusho ukuthi even solo saqala bantu laba be positive for COVID-19 babe ngu-16. Laba labang 8 njengoba sichubeka sikhumbuta sive lalabang 8 seba discharge sebasekhaya bagcine seba testa negative sebasekhaya lapho bakhona khona. Kulalabang 8 labasele labane banakelwa ekhaya labathathu basesilubombo nalwa lamhla lesitawuchubeka simikise eLubombo Referral Hospital. Litiko letempilo ke liyathanza ukuthi licele sive ukuthi nisibambise kakhulu lapha ekutheni nangabe ubonakala ukuthi so positive uvele ude sikusite usukumele eTulu nasi sitawusukumele eTulu. Lokubalekile lapha ngiko lokuthi usite usibambise kanjalo lana sesifuna laba lotsinzene nabo. Sometimes kuba likhuni kubantu ukuthi bakhumbule ukuthi ngitsinzene nalona kwenda lo msebenzi ube mudze lo kodwa siyacela kubanjiswa sive ukuthi njalo nakhona lokushayelako kule tiko letempilo atokubuta imbuzo aton screena ekhaya aton testa ekhaya nisibambise kuloko ngoba ngiyona ndlela leyo letasisita ukuthi sivikele lesifo ukuthi singachubeki kakhulu lapha eveni. Bonke labasolekako wazi wafika lapha sesithi uyasoleka sathathe ama test sale ufaka imask. Lokhu kubalekile lokho ukuthi uyifake nangekhathi endlini ngoba umkhuhlane wakho noma ngimuphi so ungathathwa nangilabanye abantu la ngekhathi endlini la ekhaya. Kubalekile ke manje siyacela sive sonke ukuthi nangabe uphuma uthambela utiyele etitolo usuka ekhaya kukahle lokuthi ufake leyo mask leyakhiwe ekhaya. Ama mask bekunene ayakhona kwakheka masinya malula bomake labanengi labakwati kuthunga batawukhona ukuthi ithungela lokwendela ukuthi uvikele labanye abantu kumkhuhlane wakho nawe utivikele ekutheni bangakukhwehlelele edude. Akukusiti ukuthi kukuvikele ku COVID-19 kusita nje ukuthi uvikele lo monye. Ngiyabekisa nangifaka imask mina ngivikela wena ukuthi ungathatha umkhuhlane kimi nawe na ufaka imask uvikela mina. Ngaloko siyasitana siyabambisana sisive ukuthi uvikele lo mkhuhlane. Angiphinze ngisikhumbude sive kafisha nje ukuthi sikuphi nalomkhuhlane njoba sesishito labang 8 bantu sebasekhaya. Kulaba labaselashwa labasasitwa kunalomake lo neminyaka leng55 lobeka case number 4 kithi uyachubeka uyelulama kodwa ulashele ekhaya. Nalo babe lona 52 naye lo sachubeka uselashelwa ekhaya bachubeka bayelulama bobabili. Lesikubonako kulala balandzelayo ukuthi banengi lesebabonakala ukuthi asati kahle ukuthi bawuthethephi lo mkhuhlane. Lokwenda sesingakhona kuqinisekisa nyalo ukuthi vele sokuthethelwe nedvute vele kusho sokuba yi local transmission. Ngilaba lekuthi nasibabuta ukuthi uhambe phi njoba sibuka abantu abachumene nabo ukhanze ukuthi umuntu uthatha isikhathi lesidze ukuthi akhumbule lo myeso yabuya sawo yathi ngelanga leli ukuthi ngangihlangane nebantu laba beyakhambeni itside. Kubalekile lokho kulaba labaselele ngidababala kuneliswati leneminyaka lengu-44 nalo lelisachubeka liyalulama sisa investigator lokuthi umkhuhlane usethephi ngoba asichumanisi kahle nemlando wekhamba. Kukhona lo neminyaka lengu-36 lo wahlangana nebantu laba besuka eSouth Africa wasala anemkhuhlane, nalo neminyaka lengu-37 naye ube necontact nemuntu lohamba aphuma njalo kuya eSouth Africa, bobabili umkhuhlane ulula, sibheke ukuthi batawuhamba bahambe babengcono. Kuna lo mfana lona minyaka lengu-14 lo sinzene namunye kunabale ngibabalela ngenhla. Sicale samix elibonjeni sosekhaya manje lapho alashelwa khona, uyachubeka uba ngcono kakhulu nje. Bese kuba khona nangakuthandi lo neminyaka lengu-55 59 babe loluswati umkhuhlane ke unemkhuhlane nje kakhudlwana kodwa ke uselibonjeni uyelashwa khona lesikubonako ukuthi uyaresponda kulokwelashwa lekulesito lokalitfolako. Loyike walamuhla lo neminyaka lengu-25 lo njengoba sesimbikile lapha ukuthi bekaye KwaZulu Natal, yena ke ngikhona mikiswa elibonjeni ukuthi ayolashelwa khona. Siyabonga bekunene.